So, Bill, tell me what's going on with the sports team.
So with the football team specifically, we had a player that tested positive, just one. And in order to be safe, we do our own contact tracing in conjunction with the Department of Health. We quarantined whatever per Department of Health guidelines. We have to quarantine the athletes that this athlete has come in contact with. All of them are asymptomatic. So all of the kids who are in quarantine are asymptomatic. So at this time, we wanted to play it safe and felt like that we need to take a little pause here. And we didn't want to risk that if a larger infection had spread or if it was more than we realized, it would be detrimental to moving forward. So we wanted to be safe per our protocols and not risk any other kids until we were 100% sure.
And what kind of pause does this involve?
So what we did is we have enough students that are in quarantine. See, the issue with COVID-19 for us has not been positive tests. We've had very few. The issue is per county guidelines and state Department of Health guidelines, when you have an athlete or adult, anybody test positive, you contact trace and you contact everyone around the person and go, you have to go into automatic quarantine until they test positive or negative. If they test positive, then these people are in quarantine, even though they may not have it. So what's happening is an entire position area, for example, was in contact enough that they're quarantined. None of them have symptoms, but to be safe, we don't feel comfortable moving forward without this entire position on the field being filled by the regular kids who play that position.
What position is it? Are you allowed to say?
I'd rather not say, just because I don't want parents to feel that their sons were identified.
Yeah, the privacy issues, totally
Yes.
understandable.
I always got to protect myself.
Yeah, no, totally. So, so it was only just the position and the coaches involved in that position and their families who had contact. No other position.
Right. So we have pretty good protocols. One of the things all of our sports teams have done is they've worked in small groups to protect themselves, which is why we had soccer Friday night. We have cross country today. We have had very, very few tests, less than 5 since July 1st. Kids test positive. Our protocols are to insulate us from this wiping out a whole team. But whenever there's been doubt or a lag time, we have erred on the side of caution.
Mm-hmm. And so the time frame again, when did one player test positive?
Last week.
Do you know what day?
Off the top of my head, I don't. It was early in the week.
Okay. And prior to that, did this position area, were there any, whole team scrimmages? Were there any other practices with other teams? And there was no contact in the 2 weeks leading up to this positive test?
Per OHSAA guidelines, football teams have not been allowed to scrimmage this year. OHSA opened it up last week. The first allowable date for a scrimmage was last Saturday. We opted to not have a scrimmage because we were in the middle of this. So we have not had any physical, actual scrimmage level football at this point.
Oh, okay. Thanks for clarifying.
Mm-hmm.
And so you guys have contacted everybody in the 2 weeks prior to, or the health department has contact traced everybody in the 2 weeks prior to this positive test?
Yes, and so we do our own contact tracing. We worked directly. We call them directly. Our trainer, Steve Pritchard, does a wonderful job. And before the county even gets a chance to even call them, we've already quarantined them ourselves. We reach out because we already know the process. We work with the county. We give them a call. They support on what else we should be doing in terms of the quarantine process. But it's the minute we find out, it's almost automatic that we're quarantining anyone that has broken. Again, it's the county protocol, a certain number of minutes, certain distance. We've taken painful precautions to make sure that happens.
So you said the player who tested positive and everybody else that have been asymptomatic. Is that correct?
Correct.
How would they come to test, even go get a COVID test if they didn't have any symptoms?
Often what we're seeing a lot of times, even with the adults, is they get tested because they're at a medical provider for another reason. There was, like, for example, people go to the doctor and, from what I'm understanding, this athlete may have had allergy type symptoms. I don't know how many of the symptoms. If you meet a certain number of symptoms, you're supposed to be tested. So this was precautionary. Well, we weren't sure, so the parents had the child tested and notified us very quickly. So again, a lot of people are very nervous about this.
Yeah.
They get a stomach ache, they get the sniffles, and they worry, they want to get tested. And I totally appreciate that. So our families have been a tremendous help in kind of stopping these things at the pass. So our football parents have worked with us to check kids at home, take temperatures before they come to practice. And this family had enough of a concern that they opted to get their child tested, and it was the right decision because it actually probably saved our football team from very low exposure.
Wow. So there might have been some like allergy types, the sneezing, and because I know you probably heard about what happened over in Mayfield with the Mayfield volleyball team. And in that case, they also asymptomatic, but brought them to take a COVID test because of that particular family's potential exposure. So that was how that came about. Because it is always curious to me, okay, well, if they're asymptomatic, how do you just like go take a COVID test,
Yeah, I mean, I've heard of people getting tests because they were going. I have. This is not Strongsville related, but people who have gotten tests because they were getting surgery in a couple weeks and not sick at all, and they go, by the way, you tested positive, which is what's so frustrating about this virus is that time period when you can spread it and nobody even knows you have it.
Right. And does that do you start thinking, oh my goodness, I mean, we kind of stumbled upon this by fluke. I mean, what are the chances, and what are the chances that there might be other players that might be asymptomatic positive?
Which has been the frustrating part. And we as Strongsville as a school system, we have spent, the athletic director, myself, all of the administration has spent a lot of time, and I do mean a lot of time, on refining and honing our protocols because we don't want to take even the slightest chance. And I spent most of my July driving around town, going to various workout sites, and even kids, and just, put your mask on, 6 feet apart, follow the rules, all of the things that we're hearing in the news that are really important. And I feel like, I think we've done a very good job of being on top of it. It's a very difficult task because of the asymptomatic component.
Yeah. Do you worry that kids, being kids and being faced with peer pressure may not be forthright with symptoms because, their fellow player might say, hey, dude, don't say anything because you might ruin it for everybody else and ruin it for another school. Do you ever worry about that?
Sure, absolutely. So I have 3 teenage girls in my house, 2 of which are at the high school and do sports. So I get it. Like my girls have been training, running since winter. They want to have a season. So one of the things we've done is we have quite a few protocols in place to check symptoms so we check our symptoms. For example, football, they're being checked before they come to practice. We're not letting them on the field and then checking them. We're checking them. We have a setup where they're coming in from a distance, spread way out, doing that symptom check. If you meet this many criteria, we send them home. One of the things that has been awesome has been that our Strongsville athletes support each other, and they want to have a season. So, they will positively peer pressure their peers. If you don't feel good, please don't come to practice. I know, like, my girls are in group chats about meets and stuff or practice and saying, if you have a fever, have your mom check it at home. Some of the team captains in our sports even will work, like, text me your temperature from home before you even leave the house. People want to have a practice so bad that I think that's kind of worked in reverse, where there's more positive peer pressure to do the right thing than anything else.
Yeah, because, kids being kids, I have 2 of my own. And, and then you hear news stories about, they actually, in another state, there was a coach who got in trouble because he actually advocated his players not to say anything because, they wanted to have a season. So, yeah, that's why I wanted to ask.
That's completely, I can tell you at our school, our coaches, so we met with all of our coaches virtually in July, and and we came to an agreement. It was not a threat, but we came to an agreement as a team that we have to be patient. I know you guys want to have a season. I know you want to win because coaches are wired to go, go, go. But the truth is that the health and safety of our kids is way more important than sports. And I'm a sports lover. I want to be out there on Friday Night Football. I want to see my girls run cross country. But the reality is the only way to defeat this virus to the point that we can have an as normal possible school year is by working together. So thus far, I can tell you the coaches at Strongsville have been wonderful to the point where they'll shut things down and notify us right away. And that's the only way this is going to work is if we do it as a team.
Yeah. So you're pretty confident about 100% buy-in to that.
I am. I'm confident. And our athletic director and myself, Denny Ziegler, and I have spent, we communicate with coaches. Like my text, I have 100 texts a day from coaches. You know what I mean? Hey, Mr. Wingler, this is what's going on. And the communication level has to be really high across your school district, your campus, or it's a losing battle.
Do you feel like you're getting enough guidance from the county? Because it's almost like the county's in a position where they actually recommended that sports not continue. So then when you have a positive case and then you go to the county, and then are they sort of saying, well, we told you so. We told you not to even, have this happen in the first place. Are you getting
the information from the county and the state? I think they've given enough guidance at the county and the state. The problem is sometimes that the information changes very rapidly, and their information doesn't always say the exact same thing. They both have kind of lived in this, it's on local control, which we appreciate, right? Because every community is unique and should make their own decisions. I don't want to complain about the guidance sometimes, but I will say the hard part for us as administrators and as a school district is, we'll create a plan, and we're tweaking that plan pretty much 7 days a week because the guidance throughout, I'm sure you watching, hearing the news cycle, the OHSAA has made so many changes in such a short period of time, which is a challenge. But I have to say, I think it should be in local control. I think it's in the right place. It's just coordinating that guidance can be an all-night activity sometime.
And it can be different from schools too, because, we have a situation in Mayfield where, 3 volleyball players tested positive. The positive test didn't come down until last Friday. But on the Wednesday prior, they scrimmaged with Kirtland. And even though Kirtland was told about the positive test, Kirtland apparently told parents, hey, it's still okay to practice and scrimmage until we, until somebody, gets symptoms on the Kirtland team. And so, parents it's inconsistent.
So I can tell you, and I have heard those stories. So in my other life, I'm also a registered nurse, and I've worked in nursing. I've worked in intensive care nursing. I was a teacher that left and came back. So, and I still do a little PRN. And I will tell you at Strongsville, under kind of my guidance at the high school, there are no exceptions. COVID is not something that so you can do that with a common cold, right? Kids get a cold. It's not maybe the best thing. You can't do that with this virus. And this comes back to, you have to put aside your desire to want to win games. That has to be secondary to your desire to keep people safe. Do I want our football team to go undefeated? Absolutely. Do I want my girls on cross country to win every meet? Absolutely. I will gladly sacrifice all of those things in order to keep our kids safe at all times. And that's just a mindset. You have to go into it with the mindset that safety is now the most number one priority for every child in a school.
Yeah, those are wise words. But my question though is, if it's down to local control, you can't control what Kirtland does. I know you guys don't play them, but
no, right.
Whoever, you can't control what Brecksville does. You guys play Brecksville, right?
Yes.
High
and in some things, yes.
But you know what I mean? So you guys are doing great about what you guys are doing, but then what if whoever you guys play, they're operating under a different set of rules? So,
right. That's where that Department of Health guidance comes in. So the Department of Health has made recommendations, and I know they're not mandates, they're recommendations So schools are good at what we do, but we're schools, right? Medical professionals are medical professionals. I would hope that all educators and all sports programs would look at what those recommendations are and follow them. You're right, there's a little bit of fear for everybody because we can't control what other schools do. I just would hope that they would see the long game, because we don't know that this virus is going to go away in 3 months. We really don't. The vaccine, everyone's excited about that, but I can't promise you that that's going to happen. So we need to learn to live with this in the best way we can. And I would hope that other schools would say, we're going to follow the advice of the county and state health department, because that's what they do full time. Anybody who doesn't follow that advice, in my opinion, is being short-sighted for the long-term way to defeat this virus.
Do you think the fits and starts, stops and goes, was pretty much inevitable? And do you think you'll have a season?
I think the starts and stops and the bumps are unavoidable. And I think there's going to be more for other schools. I do think that we will have a season in Strongsville. And I think that's because we have such rigid safety measures in place. And I do think it will be an imperfect season. And I think there's going to be kids that are going to miss, and it's unfortunate. I think there's going to be teams that are going to make the playoffs, and then something might happen. But I do think the important part here, and again, this is coming from a dad as much as a principal, that my kids are participating. It's not ideal, but they are still getting to be kids. And, and we've even talked about, like, at some of these sporting events, if we're allowing spectators, we may only have to be able to allow, I think the governor's mandates 15% of your facility. So we're talking about very small crowds. But again, that's better than the alternative. I had a daughter just graduate who got no prom and a very limited graduation. So, we're all living this, and a lot of sacrifices are being made, but we're going to get the most out of this situation that we can in Strongsville. We're going to give our kids the most positive experience that they can get.
Terrific. Thanks, Bill. I appreciate it. Do you have anything else you want to add that we didn't talk about?
No, we're good.
Perfect. Thanks so much.
You have a good one.
You too. Bye. Bye-bye.